In the past, anxiety, depression, and other mood disorders, especially in women, were often misunderstood. Women experiencing persistent sadness, mood swings, or nervousness were frequently labeled as suffering from hysteria. The term hysteria comes from the Greek word hystera, meaning uterus, reflecting the ancient belief that these conditions were caused by problems in the womb. During the 19th century, when a woman was brought to a doctor for these symptoms, the prescribed treatment was usually a pelvic massage aimed at inducing a hysterical paroxysm. Today, we understand this as orgasm, but at the time, it was believed that achieving this response would realign the uterus and restore emotional balance. Women often sought these treatments repeatedly, and the sessions could be long and exhausting for the doctors performing them manually. As demand increased, mechanical vibratory devices were invented to make the process faster and less labor-intensive. These early vibrators were marketed as medical tools for treating hysteria and related female ailments. Interestingly, the vibrator's evolution shows a combination of medical misunderstanding and technological innovation. What began as a treatment rooted in false anatomical theories eventually became a device recognized for sexual pleasure, though only long after it left the doctor's office. Over time, society began to view them as sinful or morally questionable. This strange chapter in medical history highlights not only how anxiety and depression were misunderstood, but also how gender biases shaped the treatment of women's mental and emotional health for centuries. Radioactive water as an energy drink. In the early 20th century, people weren't just drinking coffee or soda for a boost, they were drinking radioactive water. After Marie Curie's discovery of radium and polonium, radioactivity was seen as a miracle of modern science. Instead of being feared, it was marketed as a source of endless vitality. Companies sold bottled water infused with radium or uranium, claiming it could cure arthritis, increase energy, and even restore youth. One of the most famous products was Radithor, a radium-laced water sold in the 1920s as a health tonic. Wealthy socialites and athletes swore by it, drinking bottles every day. For a while, it was considered the ultimate energy booster. But the dark truth came out when Eben Byers, a millionaire industrialist, drank over 1,000 bottles of Radithor. His jaw literally disintegrated, his bones weakened, and he eventually died a slow, agonizing death from radiation poisoning. His case became infamous, and the public quickly realized that radioactive drinks weren't a miracle, they were deadly. What was once advertised as a fountain of youth turned out to be a grim reminder of how dangerous blind trust in miracle cures can be. Toothworms. For thousands of years, people believed that the cause of toothaches wasn't cavities or decay, but tiny worms living inside the teeth. This idea dates back at least 5,000 years, appearing in Sumerian texts and later spreading across ancient China, India, and Europe. The theory was simple. When the worms were quiet, the tooth was fine, but when they wriggled, the pain began. Doctors and healers tried all sorts of remedies to drive these imaginary worms out. Some prescribed rinses with vinegar, beer, or herbs. Others used heated needles or even smoking mixtures, blowing the fumes directly into the tooth to smoke the worm out. In some cultures, people claimed they had actually seen little worms crawl out of an aching tooth, most likely bits of nerve or tissue mistaken for parasites. It wasn't until modern dentistry and microscopes came along that the toothworm theory was debunked. Cavities were revealed to be the result of bacteria and decay, not squirming creatures inside our teeth. Still, the myth of the toothworm lasted for millennia, showing how far people would go to explain pain before science caught up. Smoking for asthma. Believe it or not, there was a time when doctors actually recommended smoking as a treatment for asthma. In the 19th and early 20th centuries, asthma was poorly understood, and one popular remedy was inhaling the smoke of dried herbs, tobacco, or even stramonium, a plant related to deadly nightshade. The smoke was thought to open the airways and relieve wheezing, much like an early inhaler. Cigarette companies quickly jumped on the trend, marketing special asthma cigarettes packed with medicinal herbs. Advertisements boldly claimed these cigarettes could provide instant relief, cure asthma attacks, and even improve breathing. Some brands even recommended daily smoking as a preventative treatment. Of course, we now know that filling the lungs with smoke only makes asthma worse, and contributes to far more dangerous diseases. But back then, the medical community widely accepted the idea, proving just how different medicine looked only a century ago. What was once marketed as a miracle cure for asthma is today recognized as one of the worst things you can do to your lungs. Tapeworm diet pills. In the early 20th century, the pressure to stay slim led to one of the strangest and most dangerous diets in history. Women were sold pills that contained tapeworm eggs with the promise that once swallowed, the worms would grow inside the stomach and eat the excess food, making weight loss effortless. At first, this sounded like a miracle solution. Advertisements even showed glamorous women boasting about how easy it was to lose weight with the tapeworm diet. But the reality was horrifying. The worms caused malnutrition, intestinal blockages, and infections that could spread throughout the body. In some cases, the worms grew so large they had to be surgically removed. Others weren't so lucky. Complications could be fatal. What was marketed as a slimming miracle quickly became one of the deadliest health hacks in history. Mummy powder. During the Renaissance, Europeans believed that consuming the remains of the dead could transfer strength and healing power to the living. This led to the bizarre practice of grinding up Egyptian mummies and selling the powder as medicine. Called mumia, this substance was believed to cure everything from headaches and nosebleeds to internal bleeding. It became so popular that Egyptian tombs were raided and mummies were smuggled across Europe to meet demand. Aristocrats and nobles proudly consumed it, believing they were absorbing the mystical life force of the ancient dead. The irony. What they were really eating was centuries-old, bacteria-laden human remains, and sometimes even forgeries made of dried corpses from local graveyards. Far from healing, it was a macabre placebo. Mumia is a reminder of just how far medical superstition once went, where death itself was turned into a so-called cure for life. Lobotomy, the ice pick cure. From the 1930s to the 1950s, one of the most disturbing medical treatments in history was celebrated as a breakthrough, the lobotomy. Developed by Portuguese neurologist Antonio Egas Moniz, the lobotomy was designed to treat severe mental illness, including depression, schizophrenia, and anxiety. The procedure involved inserting a sharp instrument, often compared to an ice pick, through the eye socket or the top of the skull, then severing connections in the frontal lobes of the brain. At first, doctors hailed it as a miracle. Patients who were once violent or deeply depressed often appeared calmer afterward. But the cost was devastating. Thousands were left permanently disabled, stripped of their personality, emotions, and ability to live normal lives. Some could no longer speak properly, while others spent the rest of their lives in institutions. Despite its horrors, lobotomy became incredibly popular, with tens of thousands of procedures performed worldwide. Shockingly, Moniz was even awarded the Nobel Prize in Medicine in 1949 for the invention. Today, the lobotomy is remembered as one of medicine's darkest chapters, a reminder of how desperation for a cure can sometimes lead to treatments far worse than the illness itself. Urine therapy. As strange as it sounds, urine has been used as medicine in many cultures throughout history. Ancient texts from India's Ayurveda describe it as a life-renewing elixir, while Roman physicians recommended it for everything from wounds to toothaches. Some even advised gargling with urine to whiten teeth and freshen breath. It didn't stop there. Urine was sometimes applied to cuts and burns as a disinfectant, and in desperate times, people even drank it as a universal cure for illnesses ranging from fevers to seizures. In medieval Europe, midwives and doctors sometimes read a patient's urine to diagnose disease, believing its color and smell revealed the body's hidden imbalances. While modern medicine has debunked most of these claims, urine therapy hasn't completely disappeared. Even today, some alternative healers still promote drinking urine for supposed detox and healing benefits. From ancient Rome to modern wellness fads, this practice shows just how far people will go in the search for health, even when the cure comes from the body itself. Crocodile dung as birth control. The ancient Egyptians were some of the first people to experiment with birth control, and their methods were as shocking as they were dangerous. One of the strangest involved using dried crocodile dung mixed with honey as a contraceptive. Women would insert this mixture vaginally, believing the thick paste would physically block sperm and prevent pregnancy. In their logic, The dung acted as a kind of primitive barrier method, like an ancient version of a diaphragm. But in reality, the practice was far from safe. Instead of protection, it often caused severe infections, irritation, and other health problems. Still, it shows just how resourceful and desperate people were in the search for effective birth control thousands of years ago. It's a reminder that ancient medicine often blurred the line between creativity and danger, and that not every natural remedy from the past deserves a comeback. Radium condoms and cosmetics. When radium was first discovered in the early 1900s, it was hailed as a miracle element that could restore health, energy, and even youth. Its natural glow gave it an almost magical reputation, and companies wasted no time cashing in on the craze. Soon, radium was added to everything imaginable: toothpaste, chocolates, lotions, face creams, and even condoms. Cosmetic brands promised that radium-infused powders and creams would make skin radiant and wrinkle-free. Meanwhile, radium-laced condoms were marketed as the secret to male vitality and sexual stamina. Some of these products even glowed faintly in the dark, making them seem futuristic and exotic. But behind the glowing appeal was a deadly reality. Continuous exposure to radium caused radiation burns, anemia, bone fractures, and deadly cancers. The infamous radium girls, factory workers who painted watch dials with luminous radium paint and later suffered horrifying illnesses, became a tragic symbol of this misguided obsession. By the 1930s, the dangers of radium were undeniable, and most of these products disappeared from the market. Today, radium cosmetics and condoms stand as chilling reminders of how easily science, marketing, and blind trust can create health fads that are far more dangerous than the problems they claim to cure. Electric belt therapy. In the late 1800s, when electricity was still new and mysterious, inventors began marketing it as a miracle cure for almost every ailment. One of the strangest creations was the so-called electric vitality belt. These bizarre contraptions were strapped around the waist and plugged into a small battery pack that sent jolts of current directly into the body. Manufacturers claimed the belts could restore manly vigor, cure impotence, improve circulation, and even make men more attractive to women. Some advertisements promised users unlimited stamina and renewed youth, all thanks to the magical power of electricity. The reality, however, was far less glamorous. Instead of renewed vitality, most men experienced nothing more than painful shocks, burns, and sometimes permanent injury. The belts were uncomfortable, dangerous, and completely ineffective. Still, desperate customers bought them in droves, convinced that science had finally unlocked the secret to eternal masculinity. Today, electric belts are remembered as one of the strangest scams of Victorian medicine, proof of how far people were willing to go in search of health, power, and confidence. Trepanation, drilling holes in the skull. Trepanation is considered one of the oldest known surgical practices in human history, dating back at least 7,000 years. Ancient skulls discovered in Africa, South America, and Europe show clear evidence of deliberate holes carefully carved or drilled into the bone. The belief behind this bizarre procedure was that many illnesses, headaches, epilepsy, mental disorders, or even bad behavior were caused by evil spirits trapped inside the head. By opening a hole, healers thought they could let the demons escape and restore balance. What's even more shocking is that some people actually survived trepanation. Archaeologists have found skulls where the bone shows signs of healing, meaning patients lived on after the operation. Of course, many others didn't. The risk of infection and brain injury was enormous. Amazingly, trepanation didn't disappear with ancient tribes. Versions of it were still practiced in the Middle Ages, and even in the 19th century, some doctors used skull drilling to treat brain injuries or mental illness. Today, it's often cited as one of the most gruesome examples of how far people were willing to go in the name of medicine. That's all for today. From drilling holes in skulls to drinking radioactive water, these so-called cures show the desperate lengths people once went to in search of healing. If you found this video fascinating, make sure to hit the like button, subscribe, and ring the bell icon so you never miss more unbelievable stories from history and science. And let me know in the comments, which of these bizarre treatments shocked you the most?